Hello anatomy friends, this is Dr. Alsup again, and in this video we will be discussing both anatomical position and anatomical relational terminology. The concepts in this video are extremely important, not only in anatomy, but as we get into the organ systems, you will find that a great deal of the conversations regarding the organs and its surrounding structures will utilize these terms. So this may be one that you want to return to often, particularly if you're new to anatomy. And most of these terms are described with anatomical position in mind. So we need to understand what that is first, and then we will get into the most commonly utilized relational terms with a few examples of how to use them. So anatomical position is the way one should visualize the body when describing structures on a patient, say in your notes or when discussing with a colleague. And this is important. This is not dependent on the actual position of the body, because as you might imagine, you will be seeing patients in a multitude of different positions, such as supine, which means lying on their back, or prone, laying face down. They could be on their sides, they could be sitting up, they could be moving. So there are a lot of different positions that you'll be seeing a patient. So what you will describe is an individual in anatomical position. So the anatomical position is the person standing upright with their heads, their palms, and this is key, as well as their toes facing anteriorly or towards the front. And so these are all fairly natural positioning, except for these palms that are facing anteriorly, which isn't typically how one stands naturally. But in this position, the bones of the forearm are going to be parallel to one another or not crossing over one another. So that is why the palms are facing this way in anatomical position. The feet will be parallel and not crossing over one another as well. So this is anatomical position. Sear this position into your head, as understanding this position is vital to understanding any of the relational terms we are about to discuss. Now on to the actual relational terminology, and as its name would suggest, these terms are relational in nature, as in we are comparing one structure to another. All right, so this is key. So in other words, you can't just simply say the shoulder is superior. Okay, that's great, but superior to what? And it wouldn't be superior in all comparisons. So you must always have a to what in terms of these descriptions. So it would be correct to say the shoulder is superior to the knee or say to the feet, but the shoulder is not superior to say the scalp or the nose. So you always have to have the two things that you are comparing in these relational terminologies. So let's talk a bit more detail regarding superior and inferior, and get used to this image here because we're going to keep coming back to it. I think it's an excellent reference for you as you get more used to these terms. All right, so superior, sometimes you will hear the more traditional term cranial. Superior means towards the top of the cranium, so the very top of the head, whereas inferior means more towards the soles of the feet, all right, or the bottom of the foot. So you will see that you kind of have these arrows. Superior is going to be more this way, inferior is going to be more this way. You may hear the term caudal, which means towards the foot or tail region, which for humans, the tail region is going to be the coccyx at the end of the vertebral column. All right, but we more typically use the terms superior and inferior. So think this through with me. The neck is going to be what to the thigh? All right, so here's your neck. I think we all probably know this. And here is the thigh. So the neck would be superior to the thigh, right? So we would describe the neck as superior to the thigh, or conversely, you could switch that around to the thigh is inferior to the neck. Now moving on to anterior and posterior, sometimes traditionally referred to as ventral and dorsal. Anterior means more towards the front of the body, whereas posterior means towards the back of the body or the back surface. So, if I were to say to you, the nose is what to the ear? At least in regards to these terms, what would you say? So is the nose anterior or is it posterior to the ear? Well, you would likely say that the nose is anterior to the ear because the nose is going to be more towards the front than the ears. So the nose would be anterior to the ear. All right, personal favorites of mine are medial and lateral. These terms will incorporate the median plane, which is a vertical plane that is passing right down the middle, or passing longitudinally through the body, so right down the middle portion. So things that are medial are going to be towards that median plane, and things that are lateral will be away from the median plane. So the trunk, would the trunk be medial or lateral to the upper limb? And the trunk is just this portion right here. Would the trunk be medial or lateral to the upper limbs? Well, that trunk is very close to the median plane, even incorporating it some, and so it would be more medial to the upper limbs. Lastly, let's discuss the terms proximal and distal. And these terms are unique in that they are actually independent of anatomical position, as these are comparisons to the body attachments or other linear structures. Therefore, when we're using the term proximal, this means towards the trunk or the point of origin. And when I say point of origin, you can think of, say, where an artery or a nerve branches from its source. So that would be the point of origin, whereas distal is away from. So in this example, is the palm proximal or distal to the shoulder? So take a minute to kind of think about that. Is the palm going to be further away from the trunk or closer to the trunk than the shoulder? It's going to be further away from the trunk, right? So the palm would be distal to the shoulder. And so we use these terms proximal and distal quite a bit in regard to the appendages or the upper and the lower limbs, in particular with its associated structures like the bones and the muscles. One last thing I want to touch on before we finish is that you can absolutely combine these terms to be more descriptive and more exact. So you could combine, one example I just have here, which is only one example, is superior-lateral. So you're combining superior and lateral. So you could say the eyes, say, are more superior-lateral to the nose, all right? Because the eyes are superior as well as lateral to the nose. So you can absolutely combine these terms to be more exact in your descriptions. All right, and here is our summary slide or points to take home slide. This one, maybe more so than the others, will be an excellent resource to refer to throughout these early anatomy sessions, as these terms are used so often, particularly in the dissections. Thank you for your time and attention here, and have a great rest of your day.